your Houston chiropractor, Dr. Gregory Johnson, and today we're going to be talking about how we treat herniated discs that are so extruded that they're causing not only foraminal stenosis, but canal stenosis, where the cord's coming down through there, and severe sciatica as a result of that herniated disc, which was confirmed through MRIs that we've seen on Carlos here. So Carlos, we're going to evaluate your posture first today. And let's have you flex forward then, and backwards, and neutral. Okay, we always check people's posture first, as you can see, and he's got a little bit of the forward head posture, which is increasing the weight bearing of all the paraspinal muscles from his skull all the way down to his pelvis. But he's also got a little right translation on the x-axis, and a little bit of left translation down here in the thoracolumbar spine to the left. And by the way, his sacroiliac and leg pain and sciatica is all on the left. Very good. Okay, so let's come over here and I'm going to decompress him manually, which this is by far the absolute best treatment available for treating herniated disc, bulge disc, slip disc, all the same thing, degenerative disc disease, naturally, without surgery and drugs. There we go, good. I got him in there really tight so he can't get away. But we always raise the legs up so that they're parallel with the floor. What that does, it changes the angle of the pelvis and relaxes the lumbosacral musculature all the way up, actually. Now, when we started with Carlos, we always do reflexes. His patellar reflexes were normal, but he had a totally absent reflex in the Achilles reflex on the left when we started with him. And now he's gotten up to a +1 reflex. And +2, equal and active, is normal. Take a breath through your nose. Let it all out. Excellent. Did you feel that all the way through? Good man. Very good. Deep breaths. That moves the entire spine on the x-axis from his skull all the way down to his sacrum. And look how much his reflexes increased already just doing that. And then I'm going to adjust his neck with a Palmer diversified adjusting maneuver. There. Excellent. Okay. I'm going to adjust his legs on the other table. So let's have you come over here on this next table here. Yep. Now see, we taught him how to get upright, and he does that all the time now. So he pays attention. It's always the patient to follow our instructions on activities of daily living, how to sit, lift, bend, sleep, stand, walk, everything. Now, in this position today, his right leg is short by 1/4 of an inch. When I bring it up, it's already getting even, and you feel that tighten up already, don't you, Carlos?
Yes.
And it's really tight right there. That's called a posthumnoculus end Deerfield test on the right there. And he's got pelvic subluxations on both sides in the sacrum and sacroiliac joint, so we're addressing the right sacroiliac joint here with a x-axis and z-axis, and then a y-axis and z-axis on the sacrum on the right side, right there. Now on the left side, we're adjusting the sacrum first, straight down away from L5 where the herniated disc is. And see, we're adjusting the left sacroiliac joint differently. And I'm also getting a contact right on his acetabulum, which is hip joint itself. Or not his acetabulum, but the femur where it attaches to the acetabulum. Now see, his legs are even. And I bet you this feels a little easier already.
Mm-hmm.
Yep. Now, because he has such muscular hypertonicity and even spasm, we use the Terminator, which is a very deep tissue myofascial release instrument. And the patient suffering from lumbopelvic and sacroiliac subluxations and sciatica as a result of herniated disc, you get a lot of compensatory changes in the body, not just in his spine, but all the way down into his legs and feet. See right in here, we've got a lot of extra hypertonia. You can see his involuntary reaction to that. Yeah, right there. This is my human meat tenderizer right here, called the Terminator. All right. And I bet you this one feels even easier than the last one. Yep, very good. So, now we're going to open his joints up a little bit more by putting his head in a little bit of flexion on this table. And I'm going to start right down in the T12, L1 area and work my way up. Yep, let this all, there you go. Now I'm actually going to adjust L5 right here, straight P to A, L4, there's L3. You notice the angle on my arm is changing to accommodate the way the zygapophyseal joints or facets align in the lumbar spine, which is different. I'm doing a lateral and oblique stretch of his lumbosacral and thoracolumbar spine regions. If you've ever had a herniated disc or bulged disc, you know how painful that can be and sciatica associated with that. We had a lady come in yesterday that couldn't even sit down long enough to give us her history because of severe low back pain and leg pain, and I adjusted her, decompressing her for the very first time, and she left here with 0 pain and 0 leg pain. No low back pain and no leg pain, and it was up to a 9 or 10 on a 1 to 10 scale. So her disc actually sucked right back in there immediately, because when she came in this morning, it was completely gone still. She had not had any pain in her low back or her leg since the very first adjustment. Now in other cases, like Carlos's, that are more severe herniations where the nucleus pulposus actually extrudes through the annular fibers and creates fragments, it is much